So we've gone past the introduction actually. Um, Everyone actually calls me Pico. I would like to really joke around that. I'm part of Arionkoder. Arionkoder is basically a product design development firm that helps companies throughout the process of shaping the products and scaling them. We work mainly with a one strong purpose in mind. Our company is committed to helping factor better futures for all. And this means getting really involved and committed with the health space. That's why some of you might notice we are in this event providing a grant for startup companies in the health space to help them shape and push forward the vision that they have, specifically both around design and AI capabilities. So our company is basically pushing forward to democratize access to human-centered design products. That this is a key element on building more equitable digital products. So our main focus is on how we can build value at the intersection of both design, technology, and science, because AI is not like any other technology. It requires to be mindful and really thorough throughout the processes in order not to be putting out algorithms that have not been transparently enough or validated in a conscious manner. So for that, we have three pillars in which we work and provide services: product and design, our engineering teams, and our AI labs. Our AI labs basically provide our clients with the ability to craft their own teams and test out new things. But that's enough about us, and let's get a little bit into what we want to talk today. So this is Amanda. Amanda has been with Carlos for most of her life, taking real care of helping him manage his health, especially since the big digital health solutions have come to require him to be more mindful of how to engage in that. She's recently been relocated, and now she's worried who will help throughout the Zoom calls and through the different digital platform that Carlos needs to do and use every day to manage his health. This is basically some of the many challenges and barriers we see in, because taking care of one's health is already a big daunting task, and when you add on digital health solutions, you are introducing new variables that become even more cumbersome this task. We have barriers that are related to data overload, accessibility, digital literacy. Above all, is how do we make solutions that will cater to close this gap and help basically create solutions that will help patients basically realize their full health potential. And that's where AI has a great chance to help us all towards closing that gap. There's been a lot of different solutions in which there's a proven track record of AI solutions, but there's also a lot to keep in mind while designing this if we want to design equitable digital products. Even though we have more than 520 FDA-approved AI solutions currently, this is proven to be a space in which equity still hasn't had frameworks or policies established right off the bat to continue to oversee how these algorithms, not only from an ethical standpoint, do not increase the equity gap instead of helping bridge it. So a few of the challenges that is going to be around with AI, it's all about not only building the trust around it, because we have two different sides of that coin: people over relying on AI solutions or being reluctant to actually trust what that AI solution is providing as insights. So we have both sides of the coin that we need to tackle as a challenge. Other of the things that are really important to put on this is how we leverage AI to really cater in personalizing care. Equitable access is not only the thing, it's not the only thing we need to consider for equity in health. Tech equity requires us to be able to nail down and understand deep down what is the context of the patient. How do we cross different data to understand the social factors behind it? The social determinants of health, including the zip code, location, and everything, can be catered and thought in AI solutions to provide more personalized care that will help for better outcomes. But it's not simple, as we know the data is disaggregated across different sources. So there's a big challenge there. One of the things that's also important and can be found is how do we look at the data sources and how are we training our models? What are our data sets? Do we have population that is diverse in our data sets? How are we creating throughout the process frameworks that allow us to afterwards audit AI solutions and understand what are the potential harms even AI solutions can have for this? So a few points here are also how we build the teams that are involved around this. Teams that should not always be focusing on developers, because there has been a tendency to over rely in terms of accountability to developers, but this is a more wide approach for organizations. How do we create equity policies that streamline from top down as a priority and not only throughout the development process? Because this requires the involvement and participation and time in order to validate algorithms. There's a lot of challenges in many companies that are trying to flesh out quickly AI solutions without having the proper time to validate or trying to adapt solutions that are general to specific cases. And there's a really big problem in that when we do not test enough because we do not even know the potential pitfalls or even harms that will have for patients specifically. And the accountability there also for these companies is developers are not accountable actually for those types of situations. So we need to create whole processes that allow us to have a mindful place on from people up to other that push the whole company into understanding that deploying AI solutions that are mindful of equity takes time and a lot of processes to have in places audits, frameworks, and checklists, as I'm going to discuss now a little bit. So, starting from the different challenges ahead, one of the things I also wanted to bring on was how does AI take place in designing solutions that take care of the overall journey? Because one of the approaches that are really generalized, unfortunately now, is that we tend to look at the patient in one specific area only and not caring for the whole integrated journey that it has as a patient, be it not only in specific care provider, but in different platforms that they are involved. So AI has a potential to bridge the gap also in forcing, helping keep them aligned with the different points of care that they are involved in. Oh, sorry. So one of the things that's really interesting is how some companies have proven to integrate different points of care and data that's being involved. A lot of these has been proven to have a great also impact in patient engagement, because as they feel more comfortable having all their data aggregated and understanding it more easily, it helps them have a little bit more peace of mind of not feeling that, okay, my blood results on this platform and then finally my dental care is in this other one. So having everything more integrated and integral as experience is also a big place to play. One of the things that I really wanted to do, and I think having awareness around what are the requirements to craft more equitable AI solutions. is that there are 4 or 5 key areas that have to be mindful. As I was talking about, one of the things to craft intentionally equitable AI solutions is starting from data sets that are being involved during the model training. But not only understanding what is the population that we're catering for, but also having in place or frameworks to audit and to tailor in for specific populations, because there are the two places that we can play in. If we do understand that our data sets are more oriented to a certain population, it's important that we do not push algorithms to cover for solutions that are on other populations, to give you a space. It's really normal, and we've discussed this with our AI director, that there's a lot of data sets available when they have a wide range of mainly male populations instead of female. And there's a clear difference in how females and male can respond to certain treatments, for example. So being mindful of how we are training those models, testing how those models are performing against our expected and the specific populations that are involved in, requires to have processes and frameworks, not only in terms of equity, but also in ethical. We call this ethical checklists. It sounds really simple because it's a checklist, but some companies don't even have this during their processes. And having these design and drill down into the teams that are involved in the mindset is also key, because it builds awareness and accountability, not only the developer teams, but also the broader companies. Another point here is that I wanted to talk about is transparency. Companies that are developing different AI solutions should publish, and provide really clear evidence on how those models are performing and methods. This builds trust, because this is basically one of the greatest challenges that we have. So being transparent in how the models have been trained, how they are performing, which are the frameworks that are best suited for the use, will not only build this trust, but also will help others contribute in understanding how these models can be further leveraged for helping in basically building and helping reach people's outcomes. So transparency is key, not only in this sense, but also in providing explicability. How we help both, if the end user is a patient or a provider, be it a physician, how we help the person that it's, we call it human in the loop behind looking at the results of the algorithm, explicability of those results. How do we help them understand what is, okay, what is that these models factor in to make the decision that we're showing them. And this also needs to be designed in a way that it's easier for them to quickly understand. For example, say that we're looking at the results of a computer vision product. The model quickly understands, for example, asymmetries in brain structures. How do we help physicians that are looking at those results understand which areas of the image scan have been used to provide the, let's call it, asymmetry index? How do we make it easy, not only providing this score, for example, of the algorithm, but also showing in a more, in the screen, the areas specifically that were considered to show asymmetries. Another point that I wanted to talk about is participatory design. Even though we're talking about AI solutions, is it when it's more important to actually involve not only physicians, but also patients in understanding not only the nuances that have to be catered in, for example, when we talk about context of the patients, to understand which other variables of data would be needed for that model to be more effective, but also what are the different factors that physicians consider, for example, when doing more clinician models. This needs to have a specific approach because it's not easy to build a shared language between machine learning scientists and physicians. So, for example, in our case, we work a lot of design-led approaches, creating basically workshops in which we build shared languages in a visual way. So we document lively our shared understanding and helps bridge that gap between the physician's language and the teams that are involved, and continuously also monitor how that is actually transforming, translating. Another point is that I wanted to talk about was the underrepresented populations, in particular, when talking about not only data sets but involvement throughout the experience. So there's a really interesting potential here in how we cater for the different determinants of health throughout crossing different data. And when I'm talking about this is access also can be tackled with AI solutions. We're talking about diminishing health literacy barriers, digital literacy barriers. Why? Because there's an interesting point in how AI can help build solutions that are more accessible. Voice command solutions, conversational AI can help lower those barriers in a sensible way. And one of so there are a lot of challenges ahead, but a lot of frameworks that can be used involving diverse teams, working with data sets, establishing processes, and having a clear, equitable policy. It's what it's also important. Building frameworks that are not rooted in broader commitments and policies will take little impact on what we design. So it's important that for companies in the space, build a broader commitment to equity in this space. So this is not only a thing for the companies itself that are developing, but those who also are looking to source solutions that have AI. I think there needs to be a commitment from everyone to demand and understand how is equity being addressed throughout the processes and different products that are out there that have AI. And this needs to be a really wide commitment from all. But now what I want to leave you with is with Dave, that they will share with us about OncoRx solutions insights and its product. So Dave, I will give you the pointer here. Thank you. Thank you.
Thank you, Vico. I appreciate everything you've had to say. OncoRx Insights is a cancer-focused decision support company. If you're here at this conference, obviously you know healthcare is complicated. Cancer is more complicated, probably one of the most complicated fields that anybody on the floor is discussing. And the reason I'm here is that we partnered with Arionkoder and Vico and her team to develop some things that I'll say a little bit about. But let me emphasize first that all of what Vico said is totally valid when it comes to AI solutions. And we are planning on partnering with Arionkoder for continued work in the AI space. So let me tell you a little bit about what we do and what we've done with Arionkoder. Cancer is basically a genomic-driven disease, or it can be. In some cases, you can be exposed to something in the environment that causes cancer, but that cancer kicks in by altering something in the genome. And so the rough analogy is that either you lose the brakes or somebody steps on the accelerator, and that's when cell growth happens out of control, and that's really driven by something at the molecular level in your genome. Our goal is to solve the problem of complexity related to cancer. The parties involved are the patient, the oncologist, and the pharma companies. And so the oncologist often is seeing new discoveries, new drugs coming out on a weekly basis, literally. Something new on some type of cancer and some new treatment that's been approved. They can't keep up. The majority of cancer care here in the United States happens in community settings, 80% of it. not at the academic medical centers like Dana-Farber or Cedars-Sinai or places like that. It's people in rural areas. It's people who don't have access the way Vika was talking about. And so oftentimes the oncologist doesn't have the time to really stay up to date. So we want to solve that problem. We want the patients to be more informed. We want them to help. We want to help them understand the complexity of what they're facing, and we also want them to realize it's no longer a choice of chemo or radiation. There are lots of new things happening out there that give them alternatives, but they have to be informed, and their doctor also has to be informed. So part of our solution is to bring together a diverse collection of data, information from the patient's molecular diagnostic, which is the test that they do on their cancer type, information from their previous history, things like other diseases that they might have, comorbidities, information about the drugs that might be applicable to their particular cancer. Drop that into an AI engine, and then provide insights to all of the parties involved, the oncologists, the patients, as well as the pharma companies. And this helps the pharma companies understand what they need to do to better target their drugs. It helps them understand what they need to do to develop the next generation of drugs. And it helps them understand, how their drugs are in fact working when it gets down to in the marketplace. This is a screenshot of what Arionkoder has developed for us. This is I call it an abstraction of the molecular diagnostic report that you might get from a lab, such as Foundation Medicine or Tempus. What you see in the blue boxes, or the boxes with the blue at the bottom, are identified genomic mutations that a genomic test has come up with for this particular patient. So, for example, P10 is a quite common mutation that is seen in cancer. This puts the information about that alteration at their fingertips. What you see on the right side here is a suggested drug. This one is abiraterone. I have no idea exactly what that drug does, but it's what came through on the molecular diagnostic. You also see a list of clinical trials that the patient might be eligible for. This normally comes as a PDF, and sometimes it's a faxed PDF. In this day and age, that's a little hard to believe, but it's true. And so what we've done is taken that information with Arionkoder's help and turned it into something actionable, something searchable, turned it into real data that can be abstracted. And so we get the information, but then we make it easier for the physician to actually go after it and chase down the various links. We also plan on being able to collect the oncologist's decision rationale. And then finally, we also want to deliver some very dynamic and filtered information to pharma. So let me summarize and say, Arionkoder stepped in with no real previous knowledge of cancer or genomics, and basically they learned to speak the language of our physicians and the oncologists. They learned to speak the language of genomics, and they've created what is for us a very compelling solution and an outstanding capability, and we look forward to partnering with them in the future. Highly recommend their capabilities. And Vico, thank you. Vico led the team that did the work, and so it's really a pleasure to be able to be here and talk about the work that they've done with us. So thank you very much.
Thank you, Ed. And with that, was that we wanted to share with you guys. So if you have any questions, we are in the booth on the web. So please come in and just ask us whatever you want. We're here to hear you out and help you also flesh out ideas. This is what our teams work on. And thank you, everyone.